The moment I stepped through the glass doors of Horizon Innovations as their new CEO, I watched Daniel Cooper's smile freeze on his face. 3 years of carefully crafted distance shattered in an instant as our eyes met across the crowded lobby. My ex-husband, the man who had the audacity to bring his mistress to my father's funeral 6 months ago, now stood paralyzed with shock, realizing that the company's mysterious new leader was the woman whose heart he had so carelessly broken. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed. Because tomorrow, I've saved something extra special for you. The security guard at the reception desk greeted me with professional courtesy, unaware of the personal earthquake about to reshape Horizon Innovations. "Good morning, Ms. Martinez. Your temporary access card is ready." He handed me a visitor badge, which seemed almost laughable given the documents in my briefcase clearly stated, Chief Executive Officer. I clipped it to my charcoal gray blazer, enjoying the delicious irony. Horizon's headquarters dominated. Boston's Innovation District, its sleek glass exterior reflecting the morning sun like a beacon of progress. The company my father had built from nothing over 40 years now stood as one of the leading medical technology firms in New England, and as of yesterday's closed-door board meeting, it was mine to lead. I adjusted my posture, squaring my shoulders, beneath my tailored suit. The weight of this moment, one I had imagined countless times during sleepless nights, felt both heavier and more satisfying than I'd anticipated. My journey to this lobby had been paved with grief, betrayal, and an unexpected inheritance that had changed everything. "The executive team is gathered on the 21st floor," the security guard explained, gesturing toward the elevators. "Mr. Blackwell asks that you be escorted directly to the boardroom when you arrive." Howard Blackwell, my father's oldest, friend and Horizon's interim CEO since his death, had been the only person who knew about today's announcement in advance. Together, we had orchestrated this moment of perfect corporate theater, understanding that sometimes justice requires the right audience. The elevator ride to the 21st floor gave me a precious moment of solitude to prepare. 6 months ago, I had stood at my father's graveside, barely holding myself together as Daniel appeared with Vanessa on his arm, a woman I later discovered he'd been seeing for over a year before our divorce was finalized. The humiliation of that moment had burned through my grief, leaving something harder and more determined in its place. What Daniel didn't know, what he couldn't have imagined, was that in the weeks before his death, my father had rewritten his will and restructured Horizon's leadership succession. The company everyone assumed would pass to a board-selected successor or be sold to our competitors had instead been left to me, along with my father's controlling interest. The elevator doors slid open to reveal Horizon's executive floor, a space I had visited only as Thomas Martinez's daughter, or Daniel Cooper's wife over the years. Now I walked its corridors as owner and CEO, my heels clicking purposefully against the marble flooring. Through glass walls, I could see the executive team assembled in the boardroom. 12 people whose expressions ranged from curiosity to apprehension as they awaited the announcement of their new leader. Daniel sat near the middle of the table, checking his watch impatiently, completely unaware that his professional future now rested in my hands. Marcus Johnson, my father's longtime executive assistant, approached with a warm smile. "Ms. Martinez, it's good to see you again. Everyone's waiting inside." "Thank you, Marcus. And please, call me Rebecca, or Becca, as my father did." He nodded, his eyes communicating silent support. Marcus had been one of the few people who had reached out after my divorce, offering kindness when many of my so-called friends had sided with Daniel, the rising star of Horizon's research division. "Is everything prepared?" I asked quietly. "Just as you and Mr. Blackwell arranged," he confirmed. "The press release goes live at 10:30, immediately after the announcement." I checked my watch. 10:15. Perfect timing. Taking a deep breath, I stepped into the boardroom, and the murmured conversations instantly ceased. Howard Blackwell stood from his position at the head of the table, his expression professionally neutral, though I caught the glint of satisfaction in his eyes. "Good morning, everyone," he began, commanding the room's attention. "Thank you for adjusting your schedules for this important announcement. As you know, following Thomas Martinez's untimely passing 6 months ago, the board has been engaged in a careful search for Horizon's next chief executive officer." Daniel leaned back in his chair, his posture relaxed and confident. I had heard through industry connections that he had been campaigning for a promotion to Horizon's executive team, positioning himself as someone who understood the Martinez vision. The audacity was breathtaking. "Today, I am pleased to introduce you to Horizon Innovation's new chief executive officer," Howard continued, gesturing toward me. "Rebecca Martinez." The stunned silence that followed was worth every second of the careful planning we had invested. Faces turned toward me with expressions ranging from surprise to confusion to calculation. But I only had eyes for Daniel, whose confident smile had vanished, replaced by a pallor that made his designer tie seem garishly bright against his skin. "Many of you already know Rebecca as Thomas Martinez's daughter," Howard continued smoothly. "What you may not know is that she holds dual master's degrees in biomedical engineering and business administration from MIT, and has spent the past 5 years building a successful medical technology consulting firm that has helped numerous startups navigate FDA approval." I stepped forward, placing my portfolio on the table as 12 pairs of eyes tracked my every move. "Thank you, Howard. I appreciate your kind introduction, and I'm grateful to the board for their confidence in my leadership." My voice emerged steady and clear, the voice of someone who had methodically rebuilt herself from the shattered remains of a 15-year relationship. "Some of you may be surprised by this announcement. Others may be wondering about my qualifications or my vision for Horizon's future." I let my gaze drift around the table, deliberately avoiding Daniel until the final moment, when I looked directly at him. All fair questions that I intend to address. Daniel's face had progressed from shock to something darker, a combination of disbelief and calculation that I recognized from the final days of our marriage. His mind would be racing, assessing damage, plotting responses. It was the expression he wore when caught in a lie, and I had seen it more often than I cared to remember. "Horizon Innovation stands at a critical juncture," I continued, opening my portfolio to reveal the comprehensive strategy document I had spent months preparing. "We have revolutionary technology in our pipeline, but we've grown complacent in our market approach. Our competitors at Vertex Medical are gaining ground while we've been focused on incremental improvements rather than transformative innovations." I distributed copies of my analysis and watched as expressions shifted from skepticism to interest as they reviewed the data. Even Daniel, despite his obvious personal discomfort, couldn't hide his surprise at the depth of my understanding of Horizon's position. "As CEO, my first priority will be a complete review of our research pipeline, with particular focus on the neural interface project and our cardio monitoring systems." I noticed Daniel's grip tighten on his pen at the mention of the neural interface, his pet project, and one that had consistently missed development milestones despite continued funding. "I'll be scheduling individual meetings with each department head over the next 2 weeks," I continued. "For today, I want to address any immediate questions you might have about this transition." Sophia Chen, our brilliant head of regulatory affairs, was the first to speak. "This is an unexpected but welcome development, Ms. Martinez. Will there be changes to our executive structure or reporting relationships?" "Excellent question, Sophia. There will be some reorganization, but not immediately. I want to thoroughly understand our current operations before making structural changes." As the questions continued, I maintained my professional demeanor while noting how the room gradually shifted, initial shock giving way to engagement with my responses. Throughout it all, Daniel remained uncharacteristically silent, his eyes darting between me and his colleagues as he assessed the changing dynamics. Howard Blackwell eventually stepped in, wrapping up the meeting with practiced efficiency. I think this gives everyone a good introduction to our new CEO. The formal announcement to the company will be made via email at 10:30, followed by an all-hands meeting this afternoon. Rebecca will officially assume her duties effective immediately. As the executives filed out, many stopped to offer congratulations or introduce themselves more personally. I accepted each interaction with genuine interest, recognizing that building relationships with this team would be essential to my success. Daniel lingered until last, clearly hoping for a private word. When the room had emptied except for us, he approached, wearing the charming smile that had once made my heart race, but now seemed as transparent as glass. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Becca, he began, using my nickname as if the last 3 years of silence had never happened. This is quite a surprise. Is it? I replied, gathering my materials calmly. I would have thought you'd be more perceptive, Daniel. My father always said you had good instincts. His smile tightened at the mention of my father. I had no idea Thomas was planning this. He never mentioned. Why would he discuss his succession plans with you? I interrupted coolly. You were a research director, not a board member, and certainly not family, despite how you presented yourself at his funeral. The mention of the funeral made his expression flicker with what might have been shame, quickly replaced by a calculated reasonableness. About that day, Becca, I know the timing with Vanessa was unfortunate. I should have been more considerate. Unfortunate? I repeated, finally allowing a hint of emotion to color my voice. You brought your mistress to my father's funeral, Daniel, the woman you were sleeping with while we were still married. Unfortunate doesn't begin to cover it. He had the grace to look uncomfortable. The situation was complicated. Vanessa and I'm not interested in your justifications, I cut him off. What's done is done. Now we have a new complication. I'm your boss. The reality of this reversal finally seemed to fully register, and Daniel's expression hardened. If this is about revenge, this is about business, I corrected him firmly. My father built Horizon Innovations into an industry leader, and I intend to continue that legacy. Your neural interface project is 18 months behind schedule and $14 million over budget. That's my concern as CEO, not our personal history. His face flushed. The neural interface is groundbreaking technology. Development timelines for revolutionary products can't be rushed or perfectly predicted. I understand the challenges of innovation better than you might think, I replied. But I also understand when a project needs reassessment. We'll discuss it in detail during your department review next week. I closed my portfolio with finality. For now, I suggest we both focus on maintaining professional boundaries. Our personal history has no place in this building. As I moved toward the door, Daniel made one last attempt. The board may have approved this transition, but running a company like Horizon requires experience and connections. Are you sure you're prepared for what's coming? I turned back to him, allowing myself a small smile. I spent 15 years watching my father build this company from nothing. Then I spent 3 years rebuilding my life after you destroyed it. If there's one thing I'm prepared for, Daniel, it's challenges that others think I can't overcome. With that, I walked out of the boardroom and toward the office that had once been my father's. The nameplate already displayed Rebecca Martinez, Chief Executive Officer, a detail Marcus had ensured was in place before my arrival. Inside, I allowed myself a moment alone to absorb the significance of this space. My father's presence seemed to linger in the carefully arranged shelves of medical texts, the framed patents on the wall, the view of Boston Harbor that he had loved. but the office had been subtly updated. The heavy drapes replaced with modern blinds, the intimidating mahogany desk swapped for a sleeker design that better suited my working style. A knock at the door interrupted my reverie. Marcus entered with a tablet displaying the company-wide email announcement, which had just been distributed. "It's official," he said with a small smile. "Congratulations, Becca." "Thank you, Marcus." I glanced at the tablet, seeing responses already flowing in, a mixture of surprise, congratulations, and the inevitable speculation about what this meant for Horizon's future. "There's something else you should see," he added, his expression growing more serious as he handed me a file. "This arrived from legal this morning. It seems Daniel has been having discussions with Vertex Medical. Nothing concrete enough to violate his non-compete clause, but concerning nonetheless." I opened the file to find email transcripts and meeting notes, evidence that Daniel had been exploring opportunities with our largest competitor, while simultaneously pushing for greater control over Horizon's neural interface intellectual property. "When was the most recent contact?" I asked, scanning the dates. 2 weeks ago, a dinner meeting with their head of research at the Liberty Hotel. The timing aligned perfectly with my father's prediction. In one of our final conversations, before his death, he had warned me that Daniel's ambition had grown dangerous, that he would seek advancement at any cost. "Has Daniel been informed that we're aware of these discussions?" "Not yet," Marcus replied. "Howard thought you should make that decision." I closed the file, my mind already formulating a response. "No action for now. We monitor the situation and address it during his project review next week. I want all the facts before confrontation." Marcus nodded approvingly. "Just like your father. He always said evidence speaks louder than accusations." As he left, I turned to the wall of windows overlooking the city my father had loved. 6 months ago, I had stood at his graveside, devastated by the double loss of both my father and my last illusions about the man I had married. I had felt utterly alone as I watched Daniel comfort Vanessa, who had shed theatrical tears for a man she had never even met. What neither of them knew was that just 3 weeks before his death, my father had invited me to dinner at his favorite restaurant overlooking the harbor. There, between courses of his beloved seafood, he had shared his suspicions about Daniel's divided loyalties and his decision to restructure Horizon's leadership succession. "I've watched you rebuild yourself after Daniel's betrayal," he had told me, his voice weakened by illness, but his mind still razor-sharp. "You've shown more strength and business acumen in starting your consulting firm than most people demonstrate in a lifetime of corporate climbing. Horizon needs that kind of leadership. Someone who understands both the science and the human element of what we do." I had protested, citing my relative inexperience with a company of Horizon's size, but he had been adamant. "Experience can be acquired," he'd insisted. "Integrity and vision are innate. You have both." A week later, he had introduced me to Howard Blackwell, and the succession plan had been formalized, contingent on board approval, which Howard had skillfully secured in the months following my father's death. My reflection in the window showed a woman transformed from the devastated daughter who had stood at that graveside, stronger, more focused, rightfully occupying the space that her father had prepared for her. This wasn't just about proving Daniel wrong or avenging my father's disappointment in the man he had once trusted. It was about honoring a legacy and transforming it into something even greater. My phone buzzed with a text from Howard. "Board reception tonight at 7. You made quite an impression this morning. Daniel already reaching out to individual members, exactly as predicted." I smiled at his message. My father had always said Howard could read people like books. His prediction that Daniel would attempt to undermine my authority through back channels rather than direct confrontation was proving accurate within hours. The company-wide meeting was scheduled for 2 p.m., giving me several hours to prepare for my first address to Horizon's full staff of over 300 employees. I reviewed my notes, making small adjustments to emphasize our commitment to innovation, while acknowledging the challenges ahead. When Marcus appeared at my door again, his expression was troubled. "Daniel's requested an urgent meeting with you before the company announcement. He's waiting in the small conference room." I considered refusing, then decided that avoidance would only feed speculation. "Tell him he has 10 minutes. In the conference room, Daniel was pacing, his earlier shock replaced by barely contained anger. He stopped when I entered, his attempt at a professional demeanor undermined by the tightness around his eyes. "This makes no sense, Becca," he began without preamble. "You've never worked for Horizon. You've never run a major corporation. This appointment will destabilize everything Thomas built. My lack of direct experience at Horizon is balanced by my intimate knowledge of my father's vision and my professional success elsewhere," I replied calmly. "The board reviewed my qualifications extensively before confirming this appointment." "The board was manipulated by Howard," Daniel countered. "He's always had a soft spot for you, and grief clouded his judgment after Thomas died." I raised an eyebrow. "That's quite an accusation against one of the most respected executives in our industry. Do you have evidence of this alleged manipulation, or is this simply your disappointment speaking?" His frustration visibly mounted. "You know this isn't right. There were succession plans in place long before Thomas fell ill, plans that recognized experience and contribution to the company's growth. Plans change," I replied simply. "My father reassessed Horizon's needs and the leadership qualities required to meet them. The board agreed with his assessment." Daniel moved closer, lowering his voice. "Is this really how you want to play it, Becca? Using your father's death and your family name to take control of a company you haven't earned the right to lead? Is this about punishing me for moving on?" The insinuation that my appointment was about personal revenge rather than professional qualification was exactly the line of attack I had anticipated. Daniel had always been skilled at reframing situations to position himself as the reasonable party. "My appointment as CEO has nothing to do with our failed marriage and everything to do with Horizon's future," I stated firmly. "But since you've raised the personal aspect, let me be clear. Bringing Vanessa to my father's funeral demonstrated a profound lack of judgment and basic human decency. That same questionable judgment is evident in your handling of the neural interface project and your discussions with Vertex Medical." His face paled at the mention of Vertex. "What are you talking about?" "Your dinner at the Liberty Hotel 2 weeks ago," I replied, watching his expression carefully. "And the 3 meetings before that. Did you really think no one was paying attention?" Daniel recovered quickly, his shock transforming into defensive anger. "Professional networking is part of industry research. There was nothing inappropriate about those discussions. We can debate the appropriateness of your networking during your project review," I said, glancing at my watch. "Your 10 minutes are up, Daniel. I have a company address to prepare for." As I turned to leave, he called after me, his voice carrying a warning edge. "The neural interface project has supporters on the board. If you move against it without proper technological understanding, you'll undermine your credibility before you've even started." I paused at the door. "I understand the technology better than you think, Daniel. What you should be concerned about is whether I understand you." The company-wide meeting that afternoon was a carefully orchestrated introduction to my leadership vision. Standing on the stage of Horizon's auditorium, looking out at hundreds of curious faces, I felt a curious sense of homecoming. These were my father's people, the scientists, engineers, administrators, and support staff who had helped build his dream. "Many of you knew my father," I began, intentionally establishing that connection. "Some of you worked alongside him for decades. Others joined more recently, attracted by Horizon's reputation for innovation and integrity. All of you contributed to building something extraordinary, a company that doesn't just develop medical technology, but transforms lives through it." I paused, letting my gaze travel across the audience, noting Daniel seated near the back, his expression carefully neutral. My father believed that Horizon's greatest strength wasn't our patents or our profits, but our people and our purpose. As your new CEO, I share that belief, and I'm committed to honoring his legacy while guiding us toward an even more ambitious future. Over the next 20 minutes, I outlined my vision for Horizon, emphasizing stronger investment in groundbreaking research, accelerated development timelines, and a renewed focus on the patient impact of our technologies. I acknowledged the challenges we faced from competitors and regulatory hurdles, but expressed confidence in our ability to overcome them together. As the meeting concluded and employees approached with questions and comments, I caught a glimpse of Daniel slipping out a side door, already on his phone. The battle lines were being drawn, but I was prepared. My father had taught me that leadership wasn't about avoiding conflicts, but navigating them with integrity. By evening, as I prepared for the board reception, my phone buzzed with a text from Sophia Chen. "Impressive first day. Daniel's rallying support for his project. Thought you should know he's claiming you have a personal vendetta. I'm in your corner if you need allies." I smiled at her message, grateful for the show of support. The road ahead would be challenging, but I was not alone. My father had built more than a company. He had created a community of dedicated professionals who recognized authentic leadership. Standing in his former office, my office now, I looked at his photo on the wall. "I won't let you down, Dad," I promised quietly. The sun was setting over Boston Harbor, bathing the room in golden light that felt almost like a benediction. 6 months ago, I had stood broken at a graveside, watching my ex-husband comfort his mistress while my world collapsed around me. Tonight, I stood in my father's place, ready to lead the company he had entrusted to me. Daniel had brought his mistress to my father's funeral, never imagining that my father had left me his company. The painful ending he had orchestrated had inadvertently led to this new beginning, one where I would define my own legacy beyond the shadows of both grief and betrayal. Tomorrow would bring new challenges, but tonight, in this moment, justice felt both sweet and purposeful. Not revenge, but redemption. Not an ending, but a beginning. As I navigated through my first week as CEO of Horizon Innovations, the corporate landscape revealed itself in layers of complexity that even my careful preparation hadn't fully anticipated. The executive floor buzzed with a mixture of curiosity and apprehension that followed me like a subtle perfume. Conversations would halt momentarily when I entered rooms, then resume with deliberate casualness. I recognized the dance, the same careful choreography that had surrounded my father during moments of significant company transition. My father's corner office now bore subtle touches of my presence. Family photographs replaced with modern art, his collection of antique medical devices stored respectfully in the archive room, making space for the sleek technology I preferred. The transformation felt symbolic, a visual representation of Horizon's evolution under new leadership. Marcus appeared at my door with a stack of reports, his efficiency a constant in the changing environment. "The preliminary review of all departments is complete," he said, placing the binder on my desk. Sophia Chen compiled the executive summaries. "For you, with particular attention to research division inconsistencies, as requested." "Thank you, Marcus. Has Daniel submitted his updated neural interface timeline?" A flicker of awkwardness crossed his face. "He's requested an extension until Monday. Apparently, there are some development complications he wants to address before formal documentation." I nodded, unsurprised. Daniel's pattern was emerging exactly as I'd predicted. Delay tactics designed to postpone scrutiny, while he solidified support among board members. "No extension. The original deadline stands." Marcus smiled slightly. "I'll convey that immediately." After he left, I opened the binder, focusing on the research division analysis. The neural interface project had been Horizon's most ambitious undertaking, a potential revolution in medical technology that promised to help paralysis patients regain mobility through thought-controlled prosthetics. On paper, it was brilliant. In execution, it had become a financial sinkhole with consistently missed milestones. My intercom buzzed. "Ms. Martinez, Howard Blackwell is here to see you." Howard entered with the relaxed confidence of someone accustomed to navigating corporate storms. At 65, he carried his decades of experience with an ease I admired, his silver hair and impeccable suits projecting an authority that commanded respect without demanding it. "The board is getting restless," he announced without preamble, settling into the chair across from me. "Your presentation yesterday was impressive, but Daniel has been busy. Preston and Michaels are wavering." Preston and Michaels, two board members who had been reluctant supporters of my appointment from the beginning. Their backgrounds in traditional medical device manufacturing made them naturally conservative about leadership changes. "What's Daniel's angle?" I asked, though I could already guess. "The usual. Questioning your technical expertise, suggesting your leadership might delay the neural interface rollout." Howard leaned forward slightly. "But there's something else. He's hinting at proprietary technology components that only he fully understands, creating the impression that the project's success hinges on his continued leadership." I frowned. "That contradicts all proper documentation protocols. No single person should have exclusive knowledge of critical technology at Horizon." "Indeed." Howard raised an eyebrow, which raises interesting questions about what he might be hiding. The implication hung in the air between us. Daniel had always been territorial about his projects, but creating dependency on his personal knowledge crossed a line from professional protectiveness into potential company risk. "The project review is scheduled for Monday," I said. "I want you there, along with Sophia from Regulatory Affairs and Eleanor from the board. Full transparency." Howard nodded approvingly. "Smart move." Speaking of Eleanor, she mentioned something curious. Apparently, Daniel approached her about moving some of the neural interface testing to a private facility, supposedly for efficiency. This was 3 months ago, before Thomas passed. This was new information and concerning. Did my father know about this proposal? According to Eleanor, Thomas rejected it immediately. He was adamant that all testing remain under Horizon's direct supervision. Howard's expression grew thoughtful. It was one of their last significant disagreements. The pieces were beginning to align into a pattern I didn't like. Daniel's secretiveness about technical details, his meetings with Vertex Medical, his attempt to move testing off-site, viewed individually, each might have reasonable explanations. Together, they suggested something more troubling. "I need to see the neural interface lab," I decided. "Today? Unexpectedly. Can you arrange it without alerting Daniel beforehand?" Howard smiled. "Consider it done. I'll set up a general tour of the research facilities at 3. The neural interface lab will be an improvised addition." After Howard left, I spent the morning reviewing Horizon's financial position. The company remained strong overall, but the neural interface project had consumed an increasing percentage of our R&D budget over the past 18 months. The projected return on investment depended entirely on beating Vertex Medical to market with a functioning system. At precisely 3 o'clock, Sophia Chen met me in the lobby of the research building, clipboard in hand and professional smile in place. At 42, Sophia had navigated the challenging terrain of being a woman in the medical technology field for nearly 2 decades. Her expertise in regulatory affairs made her invaluable to Horizon, and her straightforward manner had earned my father's respect and now mine. "We'll start with the cardiac monitoring division," she announced loudly enough for the receptionist to hear. "Then move to imaging technologies. Dr. Wright is expecting us." As we walked through the security doors, she lowered her voice. "Howard briefed me. The neural interface team doesn't know we're coming. Daniel's not on site. He's at a meeting downtown, but his second-in-command, Dr. Patel, is running tests today. Perfect, I replied quietly. I want genuine reactions, not a prepared presentation. The tour proceeded smoothly through 2 departments, where I made a point of engaging directly with researchers and technicians, asking substantive questions that demonstrated my understanding of their work. The message was clear. I wasn't just a figurehead CEO, but a knowledgeable leader who understood both the business and scientific aspects of Horizon's mission. An hour into the tour, Sophia checked her watch with apparent surprise. We're running ahead of schedule. Perhaps we could stop by the neural interface lab while we're in this building? Dr. Patel might be available. The security guard accompanying us made a quick call, then nodded. They can accommodate a brief visit now, Ms. Martinez. The neural interface lab occupied the entire 4th floor of the research building. Significant allocation of space that reflected the project's importance to Horizon's future. As we stepped off the elevator, the environment changed noticeably from the open, collaborative spaces of other departments to a more compartmentalized layout with additional security checkpoints. Dr. Aditi Patel met us at the entrance, her surprise at our unannounced visit barely concealed behind professional courtesy. Ms. Martinez, this is unexpected. We're in the middle of some critical testing phases. I won't disrupt your work, I assured her. I'm just getting familiar with all our key projects. A high-level overview would be appreciated. Something flickered in her expression, hesitation perhaps, before she nodded. Of course. Please follow me. The main laboratory was impressive. Cutting-edge equipment arranged in efficient workstations. Researchers focused intently on their tasks. Digital displays showed complex neural mapping sequences and response time analytics. To the untrained eye, it would appear to be the pinnacle of scientific innovation. But as Dr. Patel guided us through the space, explaining their current focus on response latency reduction, I noticed subtle inconsistencies. Reference materials seemed strategically positioned, as if for display rather than use. Several researchers appeared to be running identical tests with minimal variations. Most tellingly, when I asked specific questions about signal processing improvements, Dr. Patel's answers remained general, where technical specifics would have been appropriate. These results show significant improvement over last quarter, Dr. Patel explained, bringing up a comparative analysis on a main screen. We've reduced signal delay by nearly 40% in laboratory conditions. I studied the data, noting the impressive trajectory. Remarkable progress. Has this been verified? With human subjects yet? A brief silence followed my question. We're preparing for human trials next month, she finally replied. The FDA application is nearly complete. I'd like to see the preliminary safety protocols, I said, watching her reaction carefully, and the comparison benchmarks against Vertex Medical's similar technology. Dr. Patel's professional composure wavered slightly. I'll need to check with Daniel, Dr. Cooper, about sharing those particular documents. They contain some proprietary methodologies that we're keeping closely controlled. Sophia exchanged a quick glance with me. This level of information restriction from the CEO was unusual and potentially problematic from a regulatory perspective. Dr. Patel, I said gently, I appreciate your discretion, but as CEO, I should have complete access to all project documentation. Regulatory compliance requires transparency, particularly with human trial preparations. Of course, she conceded, though her discomfort was evident. I'll arrange for comprehensive access next week, after consulting with Dr. Cooper about the best way to organize the materials. As we continued the tour, I noticed a secured door at the far end of the laboratory, key card access with additional biometric scanning. When I inquired about it, Dr. Patel explained it housed the most sensitive prototype components and test results. That's where the real magic happens, she said with forced enthusiasm. Daniel, Dr. Cooper, maintains direct oversight of that section. Only senior team members have access. After we concluded the tour and were safely in the elevator, Sophia turned to me with a concerned expression. That was choreographed, I finished for her. They were showing us what they wanted us to see, not what we needed to see. The restricted area is troubling, she agreed. From a regulatory standpoint, having critical technology components with such limited access creates compliance vulnerabilities. Back in my office, I briefed Howard on our observations. His expression grew increasingly grave as I detailed the inconsistencies and access restrictions we'd encountered. This goes beyond normal project protectiveness, he concluded. Thomas would never have tolerated this level of compartmentalization. Something changed in the months before his death. I need to see what's behind that door, I said, and I need to understand exactly what Daniel has been sharing, or not sharing with Vertex Medical. Howard considered this for a moment. Direct confrontation might cause him to accelerate whatever he's planning. We need to be strategic. Agreed. First step, full financial and resource audit of the neural interface project, effective immediately. Second, mandatory comprehensive documentation review, citing FDA compliance requirements. Third, meeting with the full board to address governance concerns about restricted project access. Daniel will fight this, Howard warned. He'll claim you're targeting his project out of personal animosity. Let him, I replied firmly. The facts will speak for themselves. Before Howard could respond, my phone buzzed with a text message from an unfamiliar number. You're looking in the right places. More to find. Parking level B, 8 p.m. tonight. Come alone. I showed the message to Howard, who frowned deeply. Could be a setup. Daniel trying to manufacture a situation that makes you look unprofessional. Or it could be someone from the neural interface team with information they're afraid to share openly. I countered. Either way, I need to know. After a lengthy debate about security precautions, we agreed that I would meet the mysterious informant, but with subtle protection measures in place. Marcus would monitor security camera feeds, and Howard would be stationed nearby, ready to intervene if necessary. The day proceeded with a series of meetings and budget reviews that kept me occupied until evening. Throughout, my mind kept returning to the neural interface lab and the strange message on my phone. What was Daniel hiding? And who wanted to tell me about it? At precisely 8 p.m., I stepped off the elevator into parking level B, a section reserved primarily for delivery vehicles and maintenance access. The concrete space was dimly lit and eerily quiet after business hours, my footsteps echoing slightly against the hard surfaces. Hello? I called, my voice sounding unnaturally loud in the empty space. A figure emerged from behind a support column, a woman in her early 30s, dressed in business casual attire with an ID badge clipped to her belt. I recognized her as one of the researchers from the Neural Interface Lab, though we hadn't been formally introduced during my tour. Ms. Martinez, she said quietly, glancing nervously around the parking area. Thank you for coming. I wasn't sure you would. You have information about the Neural Interface project, I stated, rather than asked. She nodded, her fingers fidgeting, with the lanyard of her ID badge. My name is Lauren Miller. I've been on the Neural Interface team for 3 years. What you saw today wasn't the real project status. Explain, I prompted when she hesitated. The results being shown to the board to regulatory, they're manipulated. The technology works in controlled demonstrations, but the wider test results show dangerous inconsistencies. She pulled a flash drive from her pocket. This contains the actual test data from the past 6 months. Dr. Cooper has been selectively reporting successes while burying critical failures. I accepted the drive, studying her face for signs of deception or ulterior motives. This wasn't about exposing Daniel personally, but about protecting Horizon's integrity, patient safety, and regulatory compliance. The conference room was tense when I arrived, board members Eleanor Winters and James Preston already seated alongside, Sophia and Howard. Daniel entered last, his confident stride belying the surprise in his eyes at finding such a substantial group assembled. "This is quite the gathering for a routine project update," he remarked casually, taking a seat across from me. I wasn't aware the neural interface warranted board-level attendance at this stage. "This isn't a routine update, Daniel," I replied evenly. "We're conducting a comprehensive review of the neural interface project's status, compliance protocols, and governance structure." His expression remained neutral, but I noticed his hand tighten around his tablet. "I submitted a request to postpone detailed documentation until Monday. My team is finalizing several breakthrough analyses that would give you a more complete picture." "This review can't wait," I stated firmly. "Recent information has raised significant concerns about data integrity and regulatory compliance within the project." Daniel's eyes narrowed slightly. "What information? From whom?" Rather than answering directly, I turned to Sophia. "Ms. Chen, would you please outline the regulatory requirements for human subject testing documentation?" Sophia proceeded with a detailed presentation on FDA compliance protocols, emphasizing the absolute requirement for complete adverse event reporting and unaltered test data. As she spoke, I watched Daniel's composure gradually erode, his usual polished confidence giving way to subtle but telling signs of discomfort. "These are standard protocols that all Horizon projects follow," he interjected when Sophia paused. "The neural interface program has maintained rigorous compliance throughout its development." "That's not what the data indicates," I replied, distributing copies of my summary analysis. "These documents show at least 3 unreported adverse events, including a seizure during interface testing and systematic manipulation of test results to present a more favorable safety profile than actually exists." The room fell silent as everyone processed this information. Eleanor Winters was the first to respond, her expression hardening as she reviewed the evidence. "Dr. Cooper, these discrepancies are extremely concerning," she said, her voice carrying the weight of her decades of board experience. "Particularly given your request months ago to move testing to a private facility, a request that Thomas explicitly denied." Daniel's facade finally cracked, his expression shifting from controlled professionalism to barely contained anger. "This is a coordinated attack," he said, his voice tight. "Becca, Ms. Martinez, has been looking for ways to undermine me since her appointment. These alleged discrepancies are simply different interpretations of complex data that requires specialized knowledge to properly contextualize." "We have experts who can interpret neural interface data, Dr. Cooper," Howard countered smoothly. "The question is why they weren't given access to the complete dataset in the first place. Why maintain such compartmentalization within your own team?" Daniel's gaze darted between faces, clearly calculating his response. "Breakthrough innovation requires careful information management. Premature exposure of partial results can create misconceptions. Innovation never requires hiding adverse events from regulatory oversight," Sophia stated firmly. "That crosses from information management into potential fraud." The word fraud hung in the air like a thunderclap. Daniel's expression darkened further, his earlier charm completely evaporated. "You have no idea what's at stake," he said, addressing me directly. "Vertex is weeks away from announcing their own interface system. If they beat us to market, years of work, billions in potential revenue, all lost. Sometimes difficult decisions must be made for the greater good." "Patient safety is the greater good, Daniel," I replied, maintaining my composure despite my growing anger. "It's the foundation of everything Horizon stands for. My father understood that. He would never sacrifice safety for speed to market." At the mention of my father, Daniel's control finally snapped. "Your father was losing his edge," he exclaimed, then immediately seemed to regret the outburst. "Thomas was brilliant, but he became overly cautious in his final months. Sometimes progress requires calculated risks." Eleanor Winters stood abruptly, her normally warm demeanor replaced by icy professionalism. Dr. Cooper, as a board member, who worked with Thomas Martinez for over 20 years, I find your characterization of his judgment deeply troubling. His caution, as you call it, built Horizon into an industry leader precisely because patients and physicians trust our commitment to safety. The meeting continued for another tense hour as we methodically addressed each discrepancy, with Daniel's defenses growing increasingly weak. By the end, the path forward was clear. Howard announced the immediate suspension of Daniel's leadership of the Neural Interface project pending a full independent audit, and Sophia outlined the necessary regulatory disclosures we would make regarding the previously unreported adverse events. As the meeting concluded and people filed out, Daniel remained seated, a mixture of defeat and simmering anger evident in his posture. When only the two of us remained, he finally spoke. "You have no idea what you've done," he said, his voice now eerily calm. "The neural interface is the future of medical technology. These setbacks, these minor complications, are nothing compared to the benefits the technology will bring. If the technology is truly viable, it will succeed through proper development and honest evaluation," I replied, "not through manipulated data and hidden risks." He leaned forward, his expression intense. "Is this really about patient safety, Becca? Or is it about getting back at me for Vanessa, for moving on with my life while you were still grieving your marriage?" The attempt to reduce legitimate corporate concerns to personal grudges was so transparent it almost made me laugh. "This is about integrity, Daniel. Something you seem to have forgotten along the way. Integrity doesn't win market races," he shot back. "While you've been playing CEO for a week, I've spent years building relationships with investors, regulators, and research partners. Do you really think they'll abandon those connections based on some internal power struggle?" I stood, gathering my materials. "They'll respond to evidence, not relationships. The independent audit will determine next steps for the neural interface project and potentially for your future at Horizon." His expression shifted then, a cold calculation replacing the earlier anger. "You always did underestimate me, Becca. It was charming once. Now it's just naive." The threat was implicit but unmistakable. As I walked out, leaving him alone in the conference room, I knew the battle was far from over. Daniel had invested too much in the neural interface project, professionally and personally, to surrender without a fight. Back in my office, I found Howard waiting with an update. "Security is implementing the access restrictions to the neural interface lab as we discussed. Dr. Miller has agreed to serve as interim project lead during the audit." "Good," I replied, settling behind my desk. "What's your assessment of Daniel's next move?" Howard considered this thoughtfully. "He'll appeal to his allies on the board first." Preston seemed troubled by the evidence, but not entirely convinced. "Then he'll likely approach Vertex Medical more directly, positioning himself as a wronged innovator with valuable intellectual property." "We need to secure the neural interface intellectual property immediately," I decided. "Full documentation review, patent protection assessment, and inventory of all physical prototypes." "Already in process," Howard confirmed. Sophia is leading that effort with legal support. As Howard left to coordinate these efforts, I turned to the window, gazing out at the Boston skyline now shrouded in evening shadows. Daniel's warning echoed in my mind. "You always did underestimate me." Had I? Or had I finally seen him clearly, for the first time, not as the husband who had betrayed me, but as a corporate executive willing to compromise safety and ethics in pursuit of personal glory? My father had recognized the danger before I had. His decision to leave me Horizon suddenly felt less like a gift and more like a responsibility, a final mission entrusted to someone he believed could safeguard his legacy of innovation with integrity. My phone buzzed with a text from Marcus. "Security alert. Dr. Cooper attempting to access neural interface lab after hours. Security responding. The battle had indeed begun, and sooner than expected. I grabbed my coat and headed for the door, my resolve hardening with each step. Daniel had brought his mistress to my father's funeral without remorse. He had manipulated research data without ethical qualms. What else might he do when cornered? As I stepped into the elevator, I realized that this confrontation had evolved far beyond personal history. It had become a fight for Horizon's soul, for the principles my father had built into its foundation. And it was a fight I was determined to win. Not just for my father's memory, but for every patient whose life might someday depend on the integrity of our technology. I rushed through the corridor leading to the research building, adrenaline pushing aside the fatigue from the long day. The security alert about Daniel attempting to access the neural interface lab after hours confirmed my worst suspicions. Marcus met me at the entrance, his usually composed demeanor visibly strained. Dr. Cooper bypassed standard access protocols. Using his executive override, he explained, keeping pace beside me. Security personnel intercepted him inside the restricted area. He was removing prototype components and external storage devices. "Is he still in the building?" I asked, pushing through the door to the main laboratory floor. "Security has detained him in the conference room on this level. Howard arrived 5 minutes ago and is with him now." The implications were serious, potentially criminal. Removing proprietary technology after being suspended from project leadership crossed the line from ethical misconduct into potential theft of intellectual property. "What exactly was he taking?" I asked as we approached the conference room. "2 prototype neural connectors and a specialized data drive containing what he claimed were his personal research notes. Security has secured the items in the evidence lockup." I paused outside the conference room door, taking a moment to compose myself. This confrontation needed to be handled with precision. Emotional outbursts would only strengthen Daniel's narrative that this was personal rather than professional. Inside, Daniel sat rigidly in a chair, Howard standing across from him with arms folded. 2 security officers flanked the doorway, their presence underscoring the gravity of the situation. "Excessive force for retrieving my own research materials, wouldn't you say?" Daniel remarked as I entered, his tone deliberately casual despite the circumstances. "I was simply securing critical components that require specialized handling. Those components and data are Horizon property, Daniel," I replied calmly. "Developed with company resources, under company contracts. You know that." "Intellectual contribution isn't so easily categorized," he countered. "The core algorithms were developed from my original research. The company provided resources, but the innovation is mine." Howard shook his head slightly. "Your employment contract is explicit about invention assignment, Dr. Cooper. All research conducted during your tenure belongs to Horizon, regardless of who contributed specific elements." Daniel's expression hardened. "So this is how it's going to be? Thomas is barely cold in his grave, and you're already dismantling everything he built, starting with the most promising technology Horizon has ever developed." The attempt to use my father against me was as predictable as it was infuriating, but I kept my expression neutral. "We're not dismantling anything. We're ensuring that development proceeds with appropriate safeguards and honest reporting. The very standards my father established." "Your father understood calculated risk," Daniel insisted, leaning forward. "He built this company by making bold moves when competitors hesitated. The neural interface could transform millions of lives. Patients with paralysis, degenerative neurological conditions, trauma victims. Are you really willing to delay or potentially sacrifice that potential over some procedural concerns?" "Procedural concerns?" I repeated, allowing a hint of incredulity to enter my voice. "Unreported seizures in test subjects aren't procedural concerns, Daniel. They're serious safety issues with regulatory and ethical implications." Isolated incidents during early testing phases, he dismissed with a wave of his hand. Every groundbreaking medical technology encounters setbacks. The Wright brothers crashed planes before they flew successfully. The first cardiac pacemakers caused complications. Innovation requires perseverance through early failures. Those pioneers didn't hide their failures from oversight, Howard interjected. They documented problems specifically to solve them, not to pretend they didn't exist. Daniel ignored him, focusing entirely on me. I know what this is really about, Becca. You're using your inherited position to settle personal scores. This isn't about patient safety or corporate governance. It's about punishing me for moving on with Vanessa. The directness of his accusation hung in the air, exactly as he'd intended. He was trying to provoke an emotional reaction that would support his narrative of personal vendetta. I refused to give him that satisfaction. Your relationship status is irrelevant to this situation, I replied evenly. What matters is that you violated multiple company policies and potentially federal regulations. You manipulated test data, concealed adverse events, and now attempted to remove proprietary technology after being suspended from project leadership. I turned to the security officers. Please escort Dr. Cooper to his office to collect personal belongings only. His access to all Horizon facilities is suspended effective immediately, pending board review. Daniel stood slowly, a dangerous calm settling over his features. You're making a catastrophic mistake. Vertex Medical will announce their neural interface within weeks. Without my leadership, Horizon's version will never make it to market first. Better no product than an unsafe one, I replied simply. As security prepared to escort him out, Daniel made one final attempt. Your father would be disappointed in what you're doing to his company. This time, I couldn't entirely suppress my reaction. My father valued integrity above market position, Daniel, something you clearly never understood about him or about me. After Daniel was escorted from the building, Howard and I conducted a preliminary assessment of the restricted laboratory area. What we found was deeply troubling. Beyond the manipulated test results we'd already discovered, there were indicators of unauthorized protocol modifications, equipment customization that bypassed safety features, and most concerning, evidence that some test data had been completely erased rather than merely misreported. This goes beyond cutting corners, Howard observed grimly as we reviewed the backup systems. This is systematic deception. The question is whether it was solely Daniel's initiative or if others were complicit, I replied, scanning through access logs. Dr. Miller might have more insights, Howard suggested. As second in command, she would have had visibility into most operations, even if Daniel limited her access to certain areas. I nodded, already composing a mental list of questions for the morning meeting with Lauren. We'll need a complete security audit, too. Access records, data transfers, communications with external entities. If Daniel was planning to take this technology to Vertex, he might have already transmitted information. By the time we finished our preliminary review, it was past midnight. The Horizon building had emptied except for security personnel, the emptiness amplifying my sense of responsibility. This company that had once been my father's life's work was now facing a crisis that threatened not just its market position, but its fundamental integrity. Howard seemed to read my thoughts. Thomas chose you for exactly this reason, you know, he said, as we rode the elevator back to the executive floor. He saw in you the same unwavering commitment to doing the right thing, regardless of pressure. He couldn't have anticipated this specific situation, I replied, exhaustion beginning to color my voice. Perhaps not the details, Howard conceded, but he understood the character of the people involved. He knew Daniel's ambition had begun to override his judgment, and he knew you would stand firm where others might compromise. As we parted ways, In the parking garage, Howard added one final thought. Get some rest, Becca. Tomorrow will bring new challenges, and Daniel won't go quietly. He has too much at stake personally and professionally. His prediction proved accurate sooner than either of us expected. I awoke the next morning to multiple urgent messages. Daniel had filed a wrongful termination lawsuit against Horizon, claiming discrimination and retaliation. More concerning, the Boston Business Journal had published an article quoting anonymous sources, alleging that Horizon's leadership change had destabilized key research initiatives and potentially endangered the company's market position. By 7 a.m., I was back at Horizon, meeting with our legal team to formulate responses to both the lawsuit and the media coverage. The company's general counsel, Maria Vasquez, reviewed Daniel's legal filing with experienced precision. His claims are predictable, but potentially damaging in terms of public perception, she assessed. He's alleging that your personal history created a hostile work environment and that his removal was retaliatory rather than performance-based. We have documented evidence of policy violations and ethical breaches, I reminded her, which will be crucial in court, she agreed. But public opinion isn't always shaped by evidence alone. His narrative of a personal vendetta makes for a more compelling story than regulatory compliance issues. She wasn't wrong. The media was already framing the situation as a dramatic personal confrontation, the scorned ex-wife using inherited power against her former husband. The truth was far more complex, but complexity rarely made for attention-grabbing headlines. We need to refocus the narrative on patient safety and regulatory compliance, I decided. Prepare a statement emphasizing that my appointment preceded the discovery of these issues, and that the board fully supports the actions taken regarding the neural interface project. While the legal team drafted responses, I met with Lauren Miller to discuss the neural interface project's actual status. Without Daniel's controlling presence, she spoke more freely about the development challenges they'd encountered. The technology works brilliantly in controlled settings, she explained, displaying raw data on her tablet. The problem is consistency across different environmental conditions and individual neural patterns. Dr. Cooper became fixated on the successful test cases and began discounting or obscuring the failures. When did this pattern begin? I asked. About 8 months ago, when Vertex Medical announced their preliminary neural interface research. Before that, our approach was methodical, documenting issues to solve them systematically. After, everything became rushed. Dr. Cooper began limiting access to raw data, compartmentalizing the team, and focusing exclusively on positive outcomes in his reports. This timeline aligned with my father's growing concerns before his illness. Do you believe the technology is viable with proper development? Lauren considered this thoughtfully. Yes, but not on Daniel's accelerated timeline. We need at least another year of refined testing and safety protocols before considering human trials beyond the current limited group. By mid-morning, I convened an emergency board meeting to address both the legal situation and the project's future. Eleanor Winters attended in person, with other board members joining remotely. I presented a comprehensive overview of the evidence against Daniel, the proposed remediation plan for the neural interface project, and our communication strategy. We must be absolutely transparent about the issues we've discovered, I emphasized. Not just for legal protection, but because it's the right approach. Horizon's reputation is built on trust that our technologies are developed with patient safety as the paramount concern. Most board members expressed support, though James Preston remained visibly skeptical. Daniel Cooper has been instrumental to Horizon's research success for over a decade, he noted. His methods may have become unorthodox, but his results have consistently advanced our market position. Are we certain this level of corrective action is necessary? Eleanor Winters answered before I could. James, I've reviewed the evidence personally. This goes beyond unorthodox methods into potentially criminal misconduct. Concealing adverse events from regulatory oversight could expose Horizon to catastrophic liability if a patient were harmed by this technology. The discussion continued for nearly 2 hours, covering every aspect of the situation from legal strategy to project reorganization. By its conclusion, the board had unanimously approved my proposed course of action, a public statement acknowledging the issues discovered, full cooperation with regulatory authorities, and a restructured development approach for the neural interface technology with enhanced oversight mechanisms. As the meeting adjourned, Eleanor remained behind. "You've handled this with remarkable poise," she observed, gathering her materials. "Thomas would be proud, though not surprised. He always said you had a natural leadership instinct that surpassed even his own." The comment touched me deeply. My father had rarely offered such direct praise during his life, always pushing me to achieve more, to think more critically, to stand more firmly in my convictions. "I wish he were here to navigate this with me," I admitted. Eleanor smiled gently. "In many ways he is. I see his influence in your decisions. The prioritization of integrity over expediency, the courage to make difficult choices when easier paths present themselves." Before leaving, she added one final thought. "Be prepared for escalation, Becca. Daniel has powerful connections within the industry, and his relationship with Gabriel Norton at Vertex Medical extends beyond professional courtesy. They were roommates at Stanford." This detail, seemingly minor, added a concerning dimension to the situation. Gabriel Norton was Vertex Medical's chief innovation officer, with significant influence over their research priorities and acquisition strategies. If he and Daniel had a personal connection, the potential for proprietary information transfer became even more probable. The afternoon brought a cascade of developments. Our carefully crafted public statement was overshadowed by a CNBC interview with Daniel, who presented himself as a visionary researcher being stifled by inexperienced leadership. He carefully avoided direct accusations while implying that my appointment had been driven by family sentiment rather than qualifications. Horizon deserves leadership that understands the delicate balance between innovation and bureaucracy, he stated smoothly to the financial news anchor. Medical breakthroughs require calculated risks. Without that pioneer spirit, potentially life-changing technologies remain trapped in endless review cycles. His performance was masterful, the reasonable, passionate scientist constrained by corporate timidity. To viewers unfamiliar with the details, he would appear sympathetic, his concerns legitimate. Sophia Chen appeared at my office door as I watched the interview replay, her expression grim. "We have another problem. FDA compliance has received an anonymous tip regarding protocol irregularities in multiple Horizon research projects. They're requesting comprehensive documentation, reviews." The timing was too perfect to be coincidental. Daniel was executing a classic misdirection strategy, creating broader regulatory concerns to divert attention from his specific misconduct and position himself as a whistleblower rather than a rule breaker. "He's trying to control the narrative," I observed, muting the television. "Make it appear that Horizon has systemic compliance issues rather than focused problems with his project." "It's an effective tactic," Sophia acknowledged. "Regulatory reviews create uncertainty for investors and partners. Even if we're eventually cleared, the market impact could be significant in the meantime." She hesitated before adding, "There's something else. Marcus discovered unusual data access patterns in our server logs. Someone with executive credentials has been downloading extensive research documentation over the past 3 weeks, including projects unrelated to the neural interface." "Daniel?" "The logs show his authentication, but the access times don't always align with his known location. Some downloads occurred while he was documented as being in meetings or off-site. This suggested either credential sharing or, more concerning, remote unauthorized access. Full security audit immediately, I directed. and restrict all executive access credentials to physical, on-site authentication only, no remote logins, without secondary verification. As Sophia left to implement these measures, my phone rang with an unfamiliar number. Answering cautiously, I was surprised to hear Vanessa Wright's voice, Daniel's mistress, now partner. "Ms. Martinez," she began without preamble, "I think we should meet. There are aspects to this situation you're not aware of." My immediate instinct was to refuse, suspecting a trap or manipulation attempt. But something in her tone, a tension, that suggested more than simple alliance with Daniel, made me reconsider. "Why would you want to meet with me, Ms. Wright? Your relationship with Daniel puts you firmly on the opposite side of this conflict." "Relationships aren't always what they appear," she replied cryptically. "I have information about Daniel's activities that might be relevant to Horizon's interests." After a moment's consideration, I agreed to meet her at a public restaurant near Boston Common in 2 hours. Howard, when informed, insisted on having security personnel positioned nearby, concerned that this could be an elaborate distraction, orchestrated by Daniel. The restaurant Vanessa had selected was upscale but understated, with well-spaced tables that afforded reasonable privacy without isolation. I arrived 15 minutes early, choosing a seat with a clear view of both the entrance and the street beyond. Vanessa entered precisely on time, her confident stride and designer outfit projecting the polished image I remembered from my father's funeral. Up close, however, I noticed signs of strain beneath her carefully applied makeup, shadows under her eyes, tension around her mouth. "Thank you for agreeing to meet," she said, sliding into the seat across from me. "I imagine your instinct was to refuse." Curiosity outweighed caution, I replied evenly. "You said you have information about Daniel's activities." She nodded, glancing briefly around before leaning forward slightly. "Before I share what I know, I need to clarify something. My presence at your father's funeral was not my choice." Daniel insisted, claiming it would appear suspicious if he attended alone after your divorce. I objected, but he was persuasive. This unexpected opening caught me off guard. Of all the topics I had anticipated, an apology for the funeral incident hadn't been among them. "That's not really relevant to Horizon's current situation," I replied, keeping my tone neutral despite the painful memory her words evoked. "It's relevant to understanding Daniel," she countered. "His ability to rationalize inappropriate behavior, to prioritize appearances over empathy, these aren't just personal traits. They're operating principles that extend into his professional conduct." She opened her purse and removed a small USB drive, placing it on the table between us. 3 months ago, I found these files on Daniel's personal laptop. They're copies of research data and technical specifications that he was transmitting to someone at Vertex Medical. I stared at the drive, processing the implications of her claim. "Why would you share this with me? Aren't you and Daniel together?" She finished my question with a humorless smile. "Technically, but relationships built on deception rarely stand the test of time. I've discovered Daniel has been equally dishonest with me about numerous matters, both personal and professional, including," her expression tightened, "including the fact that he's been maintaining a parallel relationship with someone at Vertex while positioning himself for a potential transition there. Loyalty isn't Daniel's strong suit in any context." I made no move to take the drive. Caution, overriding curiosity. "If these files contain what you suggest, why bring them to me rather than law enforcement?" "Because corporate espionage cases are notoriously difficult to prosecute without insider testimony. I'm not prepared to publicly position myself against Daniel, at least not yet. But I believe Horizon should know what it's dealing with." She pushed the drive slightly closer. "Everything is there. Emails, file transfers, meeting notes. He's been systematically transferring neural interface research to Vertex for at least 5 months. The timeline aligned with our emerging understanding of Daniel's activities, but skepticism kept me hesitant. Why should I trust your motives in this, Ms. Wright? You have a personal relationship with Daniel and no connection to Horizon. My motives are admittedly self-interested, she acknowledged candidly. Daniel's actions have put me in a compromised position professionally. I work in pharmaceutical regulatory affairs. Association with someone involved in intellectual property, theft could devastate my career if this becomes public. I'm creating distance and documenting that I took responsible action when I discovered problematic behavior. Her honesty about self-interest was more convincing than any altruistic claim would have been. Still, caution demanded verification. I'll need to have these files authenticated before they can inform any decisions, I said, finally taking the drive. Of course, she agreed, rising to leave. One last thing. Daniel mentioned a private research facility where some neural interface testing was conducted outside Horizon's official protocols. It's registered under a shell company called Nexus Innovations, but it's effectively controlled by a joint initiative between Daniel and certain Vertex executives. This new information amplified the concerns that had been growing since our discovery of the manipulated test data. Off-site research facilities would explain how some development work had progressed without proper documentation in Horizon's systems. Do you have an address for this facility? I asked. It's in the files, she confirmed, along with access codes and testing schedules. Daniel isn't as careful with his information security as he should be, especially around someone he underestimates. With that parting comment, which seemed to carry personal significance beyond its literal meaning, she left the restaurant with the same confident stride with which she had entered. Back at Horizon, Howard assembled a small team including Sophia, Marcus, and 2 trusted IT security specialists to review the files from Vanessa. Working in a secured conference room with isolated systems to prevent any potential malware spread, they methodically authenticated and categorized the contents. The materials appeared genuine, Howard confirmed after 2 hours of analysis. Email headers, metadata, and document properties all align with legitimate Horizon and Vertex systems. The content is damning. Detailed transfer of proprietary neural, interface specifications, test results, and even patient response data. Sophia looked particularly troubled. The patient data transfers may constitute HIPAA violations in addition to intellectual property theft. Even with anonymization, the level of detail included could potentially allow identification of specific individuals. Marcus added, the off-site facility is registered to Nexus Innovations LLC, incorporated in Delaware 18 months ago. On paper, it's a small, independent research operation, but financial records show significant funding from a venture capital firm with strong ties to Vertex Medical. The evidence painted a clear picture of systematic corporate espionage and regulatory violations extending well beyond our initial concerns about data manipulation. Daniel hadn't just been cutting corners on safety protocols. He'd been actively transferring Horizon's proprietary technology to our primary competitor while positioning himself for a leadership role there. We need to move quickly, but strategically. I decided. First priority is securing all remaining intellectual property and implementing countermeasures for already compromised information. Second, we need to document the off-site facility and any testing conducted there. Third, we prepare legal action against both Daniel and potentially Vertex, depending on the extent of corporate involvement. The team dispersed to execute these directives, leaving Howard and me to discuss the broader implications. This changes the narrative significantly, he observed. Instead of an internal dispute about management styles or personal conflicts, we're dealing with clear corporate malfeasance with potential criminal dimensions. Daniel anticipated that we'd discover the data manipulation, I replied, thinking through the sequence of events. He didn't expect us to uncover the corporate espionage angle so quickly. That's why he's been focusing his public statements on innovation philosophy rather than specific actions. Howard nodded thoughtfully. His CNBC interview carefully avoided any mention of Vertex or specific technologies. He's creating a general narrative about innovation versus bureaucracy to distract from the actual issues. Which means our response needs to be equally strategic, I concluded. We don't address his philosophical points. We focus exclusively on the documented actions and their implications for patient safety and corporate governance. Before we could develop this approach further, Marcus returned with urgent news. We've confirmed the location of the off-site facility in Woburn, about 20 minutes north of Boston. Security footage shows Daniel entering the building less than an hour ago. The timing suggested he might be removing evidence or securing sensitive materials in response to Vanessa's actions. Do we have legal standing to access the facility? I asked. Our legal team believes so, Marcus confirmed. If patient testing occurred there using Horizon protocols or technology, we have regulatory obligation to ensure proper documentation and oversight. Additionally, if Horizon intellectual property is being stored there improperly, we have rights to recover it. I made a quick decision. Contact local law enforcement for support. I want a team ready to secure that facility within the hour. Include Sophia for regulatory compliance assessment, IT security for data systems, and legal representation to document everything properly. As Marcus coordinated this response, I prepared for what would likely become a defining moment in this rapidly evolving situation. If Daniel was indeed at the facility with Horizon proprietary technology or conducting unsanctioned testing, the confrontation would move beyond corporate politics into potential criminal territory. Howard looked concerned. Are you sure you want to be personally involved in this site visit? It could become confrontational, and Daniel is already painting you as pursuing a personal vendetta. That's precisely why I need to be there, I replied firmly. This isn't about Daniel and me. It's about Horizon's integrity and patient safety. My presence emphasizes that this is a CEO-level corporate governance issue, not a delegated personal matter. As we prepared to depart, I took a moment alone in my office, gathering my thoughts and steadying my resolve. The photograph of my father on the wall seemed to watch with quiet approval as I collected the documents we would need. He had built Horizon on principles of innovation guided by responsibility, a balance that Daniel had systematically undermined through his actions. This confrontation had evolved far beyond the personal hurt of seeing Daniel with Vanessa at my father's funeral. It had become a battle for the very soul of the company my father had entrusted to me, a test of whether integrity could prevail over unchecked ambition. As I left the office to join the response team, I felt a clarity of purpose that transcended personal history. This wasn't about the past anymore. It was about ensuring Horizon's future reflected the values upon which it had been built. The convoy of vehicles heading toward Woburn carried not just a corporate response team, but a determination to reestablish boundaries that should never have been crossed. Whatever we discovered at the off-site facility would either confirm our worst fears or provide a path toward resolution. Either way, there would be no returning to the comfortable ignorance that had allowed such violations to develop undetected for so long. The journey to Woburn passed in tense silence, the gravity of the situation weighing on everyone in the vehicle. Our small convoy included 2 Horizon security vehicles, a legal representative, Sophia, and Howard, who had insisted on accompanying me despite my suggestion that he coordinate responses from headquarters. Rain had begun to fall, streaking the windows and casting the suburban landscape in a gray haze that matched the gravity of our mission. Marcus just confirmed Daniel's vehicle is still at the facility, Howard noted, reviewing the message on his phone. Local police are standing by but remaining discreet until we determine if their intervention is necessary. The facility itself proved surprisingly nondescript, a single-story building with mirrored windows nestled in a small office park. Nothing about its exterior suggested the potentially groundbreaking neural research occurring inside, nor the ethical boundaries possibly being crossed. The discreet sign reading Nexus Innovations offered the only hint of its purpose. Our arrival, clearly wasn't expected. As we pulled into the small parking area, I noticed immediate movement behind the tinted glass entrance. Security positioned themselves strategically while Sophia and our legal counsel, Richard Torres, prepared the necessary documentation authorizing our inspection. Remember, I cautioned the team as we approached the entrance, this is about securing Horizon intellectual property and ensuring regulatory compliance. We document everything methodically, regardless of what we find. The reception area was minimalist and unmanned, with a secured door leading to the main facility. Before we could use the intercom system, the door swung open, revealing a young man in a lab coat whose expression shifted from professional greeting to confusion as he registered our numbers. "Can I help you?" he asked, glancing nervously between faces. I stepped forward, maintaining a calm, authoritative demeanor. "I'm Rebecca Martinez, CEO of Horizon Innovations. We have reason to believe unauthorized testing of Horizon proprietary technology is being conducted at this facility. We're here to inspect the premises and secure any materials belonging to our company." The researcher's eyes widened. I don't have authority to allow that. Dr. Cooper manages facility access and permissions. "Is Dr. Cooper present?" Howard inquired. "He's in the main laboratory, but..." Richard Torres intervened smoothly, presenting legal documentation. This inspection order grants Horizon representatives immediate access to any facility where its intellectual property may be improperly housed or utilized. Obstruction could result in additional legal complications. The researcher hesitated, clearly weighing his limited options before reluctantly stepping aside. "The main lab is through the secured doors at the end of this hallway. You'll need access credentials." "We have override codes," I replied, referencing the information Vanessa had provided. The confirmation that these codes worked would itself be evidence supporting her claims about Daniel's activities. As our group moved through the facility, the contrast with Horizon's main research building became immediately apparent. Where our official laboratories featured transparent workflows and collaborative spaces, this facility was compartmentalized with restricted access points between sections. The layout suggested deliberate isolation of different research components, a physical manifestation of the data compartmentalization we'd discovered in the official project. The override code successfully opened the main laboratory doors, revealing a space approximately half the size of Horizon's neural interface lab, but equipped with similarly advanced technology. 3 researchers looked up in surprise at our entrance, their expressions quickly shifting to alarm as they recognized me. Daniel was nowhere immediately visible. "Where is Dr. Cooper?" I asked directly. One researcher gestured hesitantly toward a door at the rear of the laboratory. "In the testing chamber with a subject. They're in the middle of a calibration sequence. It's not safe to interrupt." Sophia immediately moved toward the monitoring stations, her regulatory expertise guiding her to the most critical compliance concerns. "Are these active human trials being conducted?" she asked, scanning the displays. "Advanced calibration with volunteer subjects," the most senior researcher corrected nervously. "Not formal trials." "That distinction is regulatory, not semantic," Sophia countered, already documenting the displayed data with her tablet. "Any human interface testing follows specific protocols regardless of how you classify it." I approached the observation window to the testing chamber, where I could see Daniel working with an individual wearing what appeared to be a modified version of the neural interface headset. The subject, a middle-aged man with a visible mobility impairment, was attempting to manipulate a robotic arm attached to a nearby workstation. The technology appeared more advanced than what I had seen in Horizon's official laboratory. Howard joined me at the window, his expression darkening. "They're further along than our official project documentation indicates. This represents months of undisclosed development." Before I could respond, the door to the testing chamber opened, and Daniel emerged, initially focused on the tablet in his hands. When he looked up and registered our presence, his expression shifted through surprise, anger, and finally into a controlled neutrality that I recognized from countless corporate events, his public mask sliding smoothly into place. "This is a private research facility," he stated evenly, closing the testing chamber door behind him. "You have no authority to be here." "On the contrary," Richard Torres interjected, presenting the legal documentation again. "As these materials clearly establish, any testing of Horizon neural interface technology falls under corporate oversight regardless of physical location." Daniel's gaze flicked dismissively over the documents before returning to me. "So this is your play, Becca? Harassment through legal technicalities? Disrupting legitimate research that could help patients like Mr. Reynolds in there, a veteran with a spinal injury who volunteered to help advance technology that might restore his mobility." The emotional appeal was skillfully deployed, shifting focus from corporate governance to patient impact, positioning himself as the compassionate innovator and us as bureaucratic obstructionists. But the manipulation was too transparent to be effective. "If Mr. Reynolds is participating in neural interface testing, he deserves the protection of proper protocols and accurate risk assessment," I replied calmly. "Which appear to be conspicuously absent here. No monitoring physician, minimal emergency equipment, and from what I can see on these screens, no real-time safety parameter tracking." Daniel's expression tightened slightly, the first crack in his composed facade. "We're conducting preliminary calibration sessions, not clinical trials. Different protocols apply." "That's not how regulatory frameworks function," Sophia stated firmly, still documenting the laboratory setup. "Human-subject interaction with experimental medical technology follows specific guidelines regardless of how you classify the activity. The distinction you're attempting to draw doesn't exist in FDA regulations." While this exchange continued, Horizon security personnel had begun a methodical inspection of the facility, documenting equipment, data systems, and testing apparatus. One officer approached me discreetly. "Ms. Martinez, we've identified several servers and external storage systems containing what appears to be Horizon proprietary information. The configuration suggests regular data transfer between this facility and external systems not on the Horizon network." This confirmation of our suspicions shifted the situation from concerning to critical. "Secure those systems immediately," I directed. "Full documentation of all connections and transfer protocols." Daniel's carefully maintained composure finally fractured. "You have no right to touch those systems. This facility operates independently from Horizon, a research collaboration with private funding and separate intellectual property agreements." "Then you won't mind providing those agreements for immediate review," Richard countered smoothly. "Along with the informed consent documents for all test subjects, FDA correspondence regarding this testing program, and documentation of the Ethical Review Board that approved these protocols." The demand for documentation Daniel couldn't provide effectively cornered him. His response was to shift strategies entirely. "This is what Thomas feared most," he said, addressing me directly while ignoring the others. "Horizon becoming paralyzed. By excessive caution, losing its innovative edge to bureaucratic risk aversion. He built this company on calculated, bold moves, not paperwork and permissions. The invocation of my father, using his memory to justify actions that contradicted his core values, ignited a controlled anger within me. My father understood that innovation without integrity isn't progress, it's recklessness. He never would have authorized unsanctioned human testing without proper safeguards, nor the transfer of proprietary technology to competitors." "Competitors?" Daniel feigned confusion. "This is an independent research initiative to accelerate development. Any benefits would ultimately return to Horizon." Sophia, who had been examining a workstation at the far end of the laboratory, interrupted this exchange. "These system logs show direct data transfer to Vertex medical servers as recently as this morning." Testing results, calibration parameters, subject response metrics, all transmitted outside Horizon's secure environment. The revelation hung in the air like a thunderclap, too specific to deny. Daniel's expression hardened as he realized his carefully constructed narrative was unraveling beyond repair. "You don't understand the competitive realities of medical technology development," he stated coldly. Vertex was going to announce their neural interface within weeks. Horizon's official development timeline would have left us years behind. I made the decisions necessary to keep us competitive. "By stealing from one company to benefit another?" Howard asked incredulously. "While positioning yourself for a leadership role at Vertex once the technology was successfully transferred." Daniel didn't bother denying it. "Strategic career advancement. The neural interface is my life's work. I deserve to guide its development and implementation, regardless of corporate boundaries." The naked ambition in his statement, the willingness to justify any action in service of his personal goals, confirmed everything I had come to understand about the man I had once been married to. His betrayal of Horizon mirrored his betrayal of our marriage, both discarded when they no longer served his purposes. "Secure everything," I instructed our team. "Full documentation of all equipment, data systems, and testing protocols. Mr. Torres, please contact the FDA regional office directly regarding the unauthorized human testing. Sophia, ensure all test subjects have proper medical follow-up arranged." As our team mobilized to execute these directives, Daniel made one last attempt to regain control of the situation. "The board won't support this heavy-handed approach when they understand the competitive implications." Preston and Michaels specifically encouraged accelerated development trajectories. "They'll see this as sabotaging Horizon's market position." "The board unanimously approved our investigation upon reviewing evidence of your data manipulation," I replied evenly. "But they weren't yet aware of the corporate espionage dimension. I suspect that knowledge will only strengthen their support for decisive action." Before he could respond, local police officers entered the laboratory, having been summoned by Richard Torres after confirming the unauthorized transfer of proprietary information. Their presence elevated the situation, from corporate governance issue to potential criminal matter. "Dr. Cooper," the lead officer addressed him formally, "we need to ask you some questions regarding potential intellectual property theft and unauthorized human medical testing. Would you prefer to discuss this here or at the station?" Daniel's expression shifted from defiance to calculation as he assessed his rapidly deteriorating position. "I'll cooperate fully," he stated with remarkable composure given the circumstances. "But I'll need my attorney present for any formal statements." As the officers escorted Daniel from the laboratory, he paused beside me, lowering his voice. "You've won this round, Becca. Congratulations on your revenge. But this technology is bigger than Horizon, bigger than either of us. It will find its way to patients, with or without your approval." "This isn't about revenge, Daniel," I replied, quietly. "It's about ensuring that when this technology does reach patients, it's safe, properly tested, and developed with integrity. Something you seem to have forgotten along the way." The systematic documentation of the Woburn facility continued for hours, revealing a parallel research operation more extensive than we had initially suspected. Beyond the neural interface components, we discovered testing data related to several other Horizon projects, evidence that Daniel's unauthorized activities extended across multiple technology domains. By evening, we had secured all equipment and data systems for proper analysis. The 3 test subjects who had participated in recent sessions were contacted and arrangements made for full medical evaluation at Massachusetts General Hospital. The researchers were interviewed individually, most claiming limited knowledge of the irregular nature of the operation, believing it to be an officially sanctioned Horizon initiative. The drive back to Boston provided a moment to process the day's discoveries and their implications. Howard sat beside me, reviewing preliminary reports from our security team on his tablet. "The scope of this is broader than we anticipated. He noted grimly. Daniel appears to have been systematically transferring intellectual property for at least 14 months. Not just the neural interface, but elements of our cardiovascular monitoring systems and drug delivery platforms which suggests this wasn't an isolated ethical lapse focused on his pet project, I concluded. It was a calculated campaign of corporate espionage. Howard nodded. The question now becomes how high this goes at Vertex. Was Daniel operating as a rogue agent they simply took advantage of, or was this an orchestrated recruitment and extraction operation? The distinction would prove crucial for our legal strategy moving forward. If Vertex leadership had knowingly participated in soliciting proprietary information, the case became potential corporate espionage rather than merely an individual's misconduct. We'll need to proceed carefully, I decided. Full documentation before any public statements or legal actions against Vertex. Daniel remains our primary focus for now. When we arrived back at Horizon headquarters, we found Eleanor Winters waiting in my office, concern evident in her expression. The board has called an emergency session for tomorrow morning, she informed us without preamble. Preston is attempting to frame today's actions as exceeding authorized parameters. He's suggesting we've created unnecessary legal exposure for Horizon. This wasn't entirely unexpected. James Preston had been Daniel's strongest ally on the board, and his background in corporate finance made him naturally averse to any action that might impact stock valuation or create litigation risk. We have documented evidence of intellectual property theft and unauthorized human testing, I replied calmly. Our actions were not only appropriate but legally required once we became aware of these violations. Eleanor nodded in agreement. Most board members understand that. But Preston has been making calls all afternoon, constructing a narrative about overreaction and suggesting that competitive concerns should have been addressed internally rather than involving law enforcement. Intellectual property theft isn't an internal matter, Howard stated firmly. And unauthorized human testing potentially violates federal regulations. We had no legal option to handle this internally once we confirmed what was happening. I agree completely, Eleanor assured him. I'm simply preparing you for tomorrow's discussion. Come with comprehensive documentation and clear legal opinions. This needs to be framed as the governance issue it is, not the personal conflict Preston is attempting to make it. After Eleanor departed, Howard and I worked with the legal team well into the night, organizing evidence and preparing a structured presentation for the board. The case against Daniel was overwhelming once assembled chronologically. A systematic pattern of ethical breaches, regulatory violations, and corporate espionage that no responsible board could ignore. The next morning brought unexpected developments before the board meeting even began. Gabriel Norton, Vertex Medical's Chief Innovation Officer, had issued a public statement denying any corporate involvement in alleged improper technology transfers and announcing that Vertex had suspended all development work related to neural interface systems pending internal review. Damage control, Howard observed as we reviewed the statement. They're creating distance between corporate leadership and whatever arrangements they had with Daniel. More surprising was an email from Vanessa Wright containing additional documentation of conversations between Daniel and Vertex executives that contradicted their public position of ignorance. They're throwing Daniel under the bus, she wrote. But these messages show Gabriel Norton was fully aware of the source of the technology Daniel was providing. The new evidence strengthened our position significantly, demonstrating that Vertex leadership had knowingly participated in receiving Horizon proprietary information rather than being unwitting beneficiaries of Daniel's independent actions. The board meeting began precisely at 9 a.m., with all 12 members present either physically or via secure video conference. James Preston's expression was tightly controlled, but betrayed tension in the rigid set of his shoulders and the way he avoided direct eye contact as I entered. Before we begin the formal agenda, I addressed the assembled board. I want to acknowledge that yesterday's actions at the Woburn facility represent an extraordinary step in corporate governance. The decision to involve law enforcement was not made lightly, but was necessitated by the discovery of potential criminal activity involving Horizon intellectual property. I proceeded with a methodical presentation of the evidence, beginning with the initial data manipulation concerns, progressing through the discovery of the off-site facility, and culminating with the documented transfer of proprietary information to Vertex Medical. The chronology was compelling, a clear pattern of escalating violations that had necessitated each subsequent investigative step. Richard Torres followed with a legal assessment that emphasized Horizon's obligation to protect its intellectual property and comply with regulatory requirements regarding human testing. Once aware of these violations, he concluded, the company had no legally defensible option except to take decisive action. Failure to do so would have constituted negligence and potentially exposed Horizon to significant liability. When the presentations concluded, James Preston finally spoke, his tone measured but his underlying frustration evident. While the evidence presented is certainly concerning, I question whether yesterday's approach represented the optimal strategy for protecting Horizon's interests. A more discreet investigation followed by negotiated resolution might have better preserved our competitive position and market stability. Eleanor Winters responded before I could. James, the documentation clearly shows that Daniel Cooper was actively transferring proprietary technology to our primary competitor while conducting unauthorized human testing without proper safety protocols. What exactly would you consider an appropriate negotiated resolution to those activities? Preston's discomfort at the direct question was visible. I'm merely suggesting that matters of intellectual property are typically handled through civil processes rather than immediate involvement of law enforcement, which creates public exposure we might have preferred to manage differently. Under normal circumstances, I would agree, Richard interjected smoothly. However, the active human testing without proper oversight crossed into potential criminal regulatory violations. Once aware of those activities, Horizon had a legal obligation to ensure subject safety and regulatory compliance. The discussion continued for nearly 2 hours, with each board member expressing perspectives and concerns. Throughout, I maintained a focus on governance principles rather than personalities, emphasizing that our actions had been driven by documented violations rather than any personal considerations. By the meeting's conclusion, the board had unanimously approved our handling of the situation and authorized additional resources for a comprehensive review of all potentially compromised intellectual property. Even Preston, recognizing the strength of the evidence, ultimately voted in support, though his reluctance remained evident. The public and market dimensions require careful management, he cautioned as the meeting adjourned. This will inevitably impact our stock price and industry relationships in the short term, which is why our communications strategy emphasizes Horizon's commitment to integrity and proper governance, I replied. We're demonstrating that we will uphold the highest ethical standards, even when difficult or temporarily disruptive. As board members departed, Howard remained behind, his expression thoughtful. James raises a valid concern about market impact, though his timing is questionable. The real test will be how we balance addressing these violations with maintaining momentum on key projects, which is why I've asked Sophia to prepare a comprehensive project continuity plan, I confirmed. The neural interface technology remains valuable and potentially transformative for patients. We need to rebuild the research program with proper oversight and realistic timelines. The remainder of the day brought a cascade of developments. Daniel had been released on bail, but was prohibited from accessing any Horizon facilities or contacting company personnel. The FDA had initiated a formal investigation into the unauthorized testing at the Woburn facility. Most significantly, our legal team had filed for a temporary restraining order preventing Vertex Medical from utilizing any technology derived from Horizon intellectual property. By late afternoon, the inevitable media coverage had begun, with the Boston Globe publishing a detailed investigation into the corporate espionage allegations rocking Boston's medical technology sector. The article presented a reasonably balanced assessment, noting Daniel's distinguished research background while outlining the serious nature of the alleged violations. I had just finished reviewing the article when Marcus appeared at my door, his expression suggesting additional complications. Financial analysts have issued their first assessments, he reported. Horizon stock is down 7% in after-hours trading. The uncertainty is creating predictable market reactions. This temporary valuation impact had been anticipated, but the magnitude exceeded our projections. What are they specifically citing as concerns? I asked. Development timeline disruptions primarily, Marcus replied. Questions about whether the neural interface project can proceed without Daniel's leadership, and whether the regulatory investigations might broaden to other Horizon products. These were legitimate questions that required thoughtful responses rather than defensive reactions. Schedule a briefing with key financial analysts for tomorrow morning, I decided. We'll address their concerns directly with our project continuity plans, rather than allowing speculation to drive valuation. As evening approached, I found myself alone in my office, watching the Boston skyline transition from daylight to the scattered constellation of office lights that defined the city after dark. The photograph of my father on the wall seemed to observe this moment of reflection with quiet approval. The week's events had transformed Horizon in ways that extended far beyond personnel changes or project reorganizations. We had confronted fundamental questions about our corporate character, choosing difficult integrity over comfortable compromise, transparency over expediency. These weren't simply operational decisions, but statements of values that would shape the company's culture moving forward. My phone buzzed with a text from Howard. Vertex legal requesting settlement discussion tomorrow. They're moving quickly to contain potential damage. Also, preliminary neural interface team assessment complete. Technology viable with proper development approach. Not as compromised as we feared. Both pieces of information represented positive developments. The first suggesting that Vertex recognized their vulnerable position. The second confirming that the underlying technology remained promising despite Daniel's ethical breaches. I typed a brief acknowledgement, then returned to my contemplation of the evolving situation. A soft knock at my door interrupted these thoughts. Lauren Miller stood in the doorway, her expression reflecting a complex mixture of concern and determination. "Dr. Miller," I greeted her, gesturing toward a chair. "Thank you for your work today with the project assessment team." She sat, clearly organizing her thoughts before speaking. "The neural interface technology remains viable," she began directly. Daniel's methods were deeply flawed, but the core innovation has genuine potential to help patients with mobility impairments and neurological conditions. That's consistent with the preliminary reports, I acknowledged, which raises important questions about how we proceed. Lauren nodded, her professional demeanor momentarily giving way to more personal conviction. "I've spent 3 years of my career on this technology. Many of us on the team believe in its potential despite what's happened. We'd like the opportunity to rebuild the research program properly, with appropriate oversight, realistic timelines, and absolute transparency." Her commitment was evident and admirable, particularly given the turmoil of recent days. "What would you need to make that happen?" I asked. "Restructured leadership with clear ethical guidelines, consolidated research, no more fragmented teams or compartmentalized data, realistic development timelines that prioritize safety over market positioning, and..." She hesitated briefly. "A commitment from Horizon to prioritize patient access over maximized profit margins when the technology eventually reaches commercialization." This last request revealed the idealism that likely drew her to medical technology research initially, a genuine desire to improve lives rather than merely build career advancement or corporate valuation. It resonated with my father's original vision for Horizon. "Those all seem like reasonable foundations for rebuilding the program," I replied. "Draft a formal proposal with your team, and we'll discuss implementation next week." After Lauren departed, I made one final call before leaving for the evening, to Eleanor Winters, whose guidance and support had proven invaluable throughout the week's challenges. "The neural interface team wants to rebuild the program," I explained after briefing her on the day's developments. "They're passionate about the technology's potential despite Daniel's actions." "That's encouraging," Eleanor replied. "Research teams often fracture after leadership scandals. Their commitment suggests the program has genuine merit beyond Daniel's promotion of it." "Which raises a question about board oversight moving forward," I continued. "We need to establish stronger governance protocols for advanced research initiatives without creating bureaucracy that stifles innovation." Eleanor was quiet for a moment, considering this balance. "Thomas always said that oversight works best when it's collaborative rather than adversarial, integrated into the development process rather than imposed upon it. Perhaps that's the model to explore." The reference to my father's philosophy felt particularly relevant given how far Daniel had strayed from those principles. "I'd like to establish a research ethics committee that includes both scientific leadership and patient advocates," I proposed. "Direct involvement of those who will ultimately be affected by the technologies we develop." "A community of accountability," Eleanor observed approvingly. Thomas would have appreciated that approach. After concluding the call, I gathered my things to finally head home after the extraordinary events of recent days. The building had quieted, most employees having departed hours earlier. As I walked through the executive floor toward the elevator, I paused briefly at the doorway to what had once been Daniel's office, now empty, his personal items packed in boxes stacked neatly against one wall. The space represented both an ending and a beginning, the conclusion of a chapter defined by ambition unmoored from ethics, and the opportunity to establish leadership grounded in integrity. Whatever came next for Horizon would build upon the difficult decisions of these past days, the willingness to prioritize principle over expedience. The elevator doors opened to reveal an unexpected figure, Vanessa Wright, her expression composed, but her presence surprising given the circumstances. "Ms. Wright," I acknowledged with cautious neutrality. "This is unexpected." She stepped aside to allow me to enter the elevator, then pressed the lobby button. "I wanted to thank you personally for handling the information I provided with discretion. My name hasn't appeared in any of the coverage." "We focused on the corporate governance issues rather than personal dimensions," I replied. "Your role wasn't relevant to the regulatory and legal concerns." She nodded, seeming to choose her next words carefully. "I've accepted a position in California," she said finally. "A fresh start seems appropriate given recent events." The information wasn't particularly surprising, maintaining a connection to Daniel during what would likely be a protracted legal battle would be complicated professionally and personally. Still, her decision to share this information directly suggested a desire for some form of closure. "I wish you well," I offered simply as the elevator reached the lobby. She hesitated before exiting. "He wasn't always the person you saw these past days," she said quietly. "Or perhaps he was, and some of us just chose not to see it clearly. Either way, I'm sorry for my role in painful events." The unexpected apology, more direct than her previous comments about the funeral, caught me off guard. Before I could formulate a response, she continued, "Your father built something remarkable here. I hope you can preserve what made it special despite recent complications." With that, she stepped from the elevator and walked toward the exit, leaving me with the curious sensation of unexpected resolution. Her acknowledgement didn't erase the pain of past events, but it offered a certain clarity. recognition that actions have consequences that extend beyond immediate circumstances. Outside, the evening had turned pleasantly cool, the earlier rain having cleared to reveal scattered stars visible even through Boston's ambient light. I paused briefly on the steps of Horizon headquarters, looking up at the building my father had built from vision into reality. The company would face challenges in the coming months, rebuilding compromised research programs, navigating regulatory investigations, addressing market concerns about stability and leadership. Yet beneath these immediate pressures lay a renewed clarity of purpose. The crisis Daniel had created through his ethical breaches had forced a recommitment to fundamental principles: integrity in research, transparency in operations, accountability at all levels of leadership. These weren't merely corporate values, but the essential foundation for meaningful innovation in medical technology, where patients' well-being ultimately depended on the ethical choices made in laboratories and boardrooms. As I walked toward my car, I felt a sense of purpose that transcended the personal journey that had brought me to Horizon's leadership. What had begun with the shock of seeing Daniel at my father's funeral with Vanessa had evolved into something far more significant than personal vindication. The company my father had entrusted to me faced a critical juncture, an opportunity to redefine itself not simply as a developer of medical technologies, but as a model of responsible innovation in an industry where ethical boundaries were constantly tested by competitive pressures and market demands. Tomorrow would bring new challenges: negotiations with Vertex, discussions with financial analysts, planning sessions for restructured research programs. But tonight, in this moment of temporary quiet between storms, I allowed myself to acknowledge both how far we had come and the distance yet to travel. The path forward would not be easy, but it would be guided by principles my father would have recognized and approved. The belief that innovation achieves its greatest potential when anchored in unwavering integrity. 3 months after uncovering Daniel's betrayal and the web of corporate espionage he had woven, I stood at the podium in Horizon's main auditorium, addressing our employees on what we had come to call Recalibration Day. The atmosphere was markedly different from the tension-filled weeks that had followed the Woburn facility raid and Daniel's subsequent arrest. Today, there was a palpable sense of renewed purpose and cautious optimism throughout the room. When I became CEO following my father's passing, I spoke about honoring his legacy of innovation guided by integrity. I began, looking out at the assembled faces, some familiar, many new. What I didn't anticipate was how thoroughly that commitment would be tested in the months that followed. Today marks an important milestone in Horizon's journey, not just recovery from a significant breach of trust, but transformation into something stronger than before. The quarterly results displayed on the screen behind me told a story of remarkable resilience. After an initial stock drop of nearly 20% following the public disclosure of Daniel's activities, Horizon had gradually rebuilt investor confidence through transparency and decisive action. Our share price hadn't fully recovered, but the trajectory was steadily upward as the market responded to our restructured research programs and strengthened governance protocols. The Neural Interface project has been completely reorganized under Dr. Lauren Miller's leadership, I continued, gesturing toward Lauren in the front row. Following rigorous review, the FDA has approved our revised testing protocols, and initial results from the properly conducted trials show promising outcomes for mobility improvement in patients with spinal injuries. This announcement generated a ripple of applause, a collective acknowledgement of the team's perseverance in salvaging valuable research from the ethical disaster Daniel had created. Lauren's commitment to rebuilding the program with uncompromising standards had transformed a potential corporate catastrophe into what industry analysts were now calling a model for responsible medical technology development. Our settlement with Vertex Medical has been finalized, I added, addressing one of the most complex aspects of the aftermath. While the details remain confidential, I can share that Horizon's intellectual property rights have been fully protected, and our Position in the neural technology sector remains secure. What I didn't elaborate on was the behind-the-scenes negotiation that had led to this resolution. Vertex, recognizing their vulnerable legal position once evidence of their executives' knowledge became irrefutable, had moved quickly to contain potential damage. The settlement included substantial financial compensation and strict prohibitions against utilizing any technology derived from Horizon's research, effectively requiring Vertex to restart their neural interface program from my fundamentally different scientific approaches. Most significantly, I continued, Horizon has established the Thomas Martinez Innovation Ethics Institute in partnership with Harvard Medical School and MIT. This independent body will provide oversight guidelines for emerging medical technologies, helping ensure that competitive pressures never again compromise patient safety or research integrity. This initiative represented my most personal contribution to Horizon's restructuring, a living memorial to my father's values that would extend beyond our company to influence the broader medical technology industry. The Institute would combine scientific expertise with ethical leadership, creating frameworks for responsible innovation that balanced progress with protection. As I concluded the formal presentation and opened the floor for questions, I noticed Eleanor Winters smiling approvingly from her seat near Howard. The past months had forged a powerful alliance between us, her board leadership complementing my executive direction as we navigated the complicated process of corporate rehabilitation. The questions came rapidly, reflecting the community's engagement with our transformation. Employees inquired about specific research timelines, regulatory relationships, and competitive positioning. There was a particularly poignant moment when a longtime researcher asked about maintaining innovation momentum while implementing stronger oversight mechanisms. That balance is precisely what defines Horizon's approach moving forward, I replied. Integrity and innovation aren't opposing forces. They're complementary strengths. Our most valuable breakthroughs will come when we maintain unwavering commitment to both. After the meeting concluded, Howard joined me as I gathered my materials. Thomas would be proud, he noted quietly. Not just of the company's recovery, but of how you've shaped its future direction. Sometimes I wonder if he anticipated something like this, I admitted. Whether he sensed problems developing with Daniel and the neural interface program before his illness progressed. Howard considered this thoughtfully. Thomas had remarkable instincts about people. He may not have known the specific issues, but he clearly recognized who had the character to address them when they emerged. We walked together toward the executive offices, passing the newly renovated research wing where transparent glass walls had replaced the opaque partitions of the previous design. A physical manifestation of our commitment to transparency and collaborative oversight. The Daniel Cooper trial begins next month, Howard noted as we reached my office. The prosecutor believes the evidence is overwhelming, but these cases can be unpredictable. Are you prepared for the public attention it will bring? The criminal proceedings against Daniel represented both a necessary accountability measure and a potential reopening of painful history. The charges were substantial: intellectual property theft, fraud, violations of patient safety regulations, and conspiracy with Vertex executives to misappropriate Horizon technology. I'm prepared, I assured him. My testimony will focus entirely on corporate governance issues and documented violations. Nothing personal. Howard nodded, though his expression suggested he understood the impossibility of completely separating the personal and professional dimensions of the situation. Daniel had betrayed Horizon's trust just as he had betrayed our marriage. Patterns of behavior that revealed a fundamental character failing rather than isolated lapses in judgment. The board meeting this afternoon should be straightforward, he said, changing the subject. The quarterly results are strong enough to satisfy even Preston, and the neural interface breakthrough announcement has already positively impacted our stock in pre-market trading. After Howard departed, I took a moment alone in my office, surveying the space that now felt genuinely mine rather than inherited. I had replaced my father's imposing mahogany desk with a more collaborative workspace, installed digital displays, tracking our key research initiatives, and lined the walls with photographs of patients whose lives had been improved by Horizon Technologies. Constant reminders of our ultimate purpose beyond corporate metrics. My contemplation was interrupted by Marcus's appearance at the door, tablet in hand. "Sorry to disturb you, but there's something you should see," he said, his expression uncharacteristically hesitant. "It's from Daniel's personal email accounts, discovered during legal discovery for the criminal case." He handed me the tablet, open to an email Daniel had written to Gabriel Norton at Vertex 3 days before my father's funeral. The message was brief but devastating in its calculated coldness. "Thomas Martinez's condition has deteriorated significantly. His daughter Rebecca remains unaware of our arrangements regarding neural tech transfer. Her emotional state following his death should create sufficient distraction for us to complete the asset migration. We'll bring V to funeral to reinforce separation narrative and minimize suspicion about timing." The clinical detachment with which Daniel discussed my father's death and my grief as strategic opportunities sent a chill through me, despite the warmth of the office. Even knowing the extent of his ethical compromises, this deliberate exploitation of personal tragedy revealed a callousness that still had the power to shock. "The prosecution wanted you to see this before it potentially becomes public during trial," Marcus explained quietly. "They believe it demonstrates premeditation and calculated deception that strengthens their case." I handed the tablet back to him, taking a moment to process this new information. "Thank you for sharing this, Marcus. Please let the prosecutors know I've received it and am available if they need additional context." After he left, I turned to the window overlooking Boston Harbor, the same view my father had contemplated during his years leading Horizon. The email clarified something that had lingered as an unresolved question: whether Daniel's appearance at the funeral with Vanessa had been merely insensitive or deliberately calculating. Now I understood it had been a conscious strategy, a cynical performance designed to reinforce narratives that served his corporate espionage activities. Yet strangely, this revelation brought a certain closure rather than reopening wounds. The person described in that email, coldly strategizing around a man's death and his daughter's grief, was so far removed from anyone worthy of emotional investment that it only confirmed the rightness of the path forward I had chosen for both myself and Horizon. My reflection was interrupted by a reminder notification. My quarterly visit to Clearwater Rehabilitation Center was scheduled for this afternoon following the board meeting. This regular commitment had become one of the most grounding aspects of my leadership, connecting corporate decisions to their human impact in immediate and meaningful ways. 2 hours later, having successfully navigated a board meeting that had unanimously approved our restructured research initiatives, I arrived at Clearwater. The center specialized in traumatic spinal injuries and neurological conditions. Precisely. The patients our neural interface technology was designed to help. Dr. Amelia Patel, the center's medical director, greeted me warmly. "Perfect timing," she noted as we walked toward the physical therapy wing. "Michael Jenkins is just finishing his session with our prototype, and he's been asking when you'd visit again." Michael had been among our first properly authorized AI test subjects after the research program's restructuring, a former construction worker whose spinal injury had left him with limited mobility below the waist. His progress with the refined neural interface system had exceeded expectations, offering hope not just for his recovery, but for the technology's broader potential. As we entered the therapy room, Michael looked up from the robotic assistance frame he was using to practice standing. A modified version of the neural headset I had seen at the Woburn facility was positioned carefully on his head, but this version featured safety monitoring displays and emergency shutdown protocols that had been conspicuously absent in Daniel's unauthorized testing. "Ms. Martinez," he greeted me with a broad smile, "just in time to see me take actual steps today." With focused concentration, Michael initiated the neural command sequence Lauren's team had refined through months of careful development. The robotic frame responded to his thoughts, supporting his movement as he took 3 deliberate steps forward, small in distance but monumental in significance. The therapists monitoring the session exchanged glances of cautious excitement, documenting every aspect of the successful interaction between mind, technology, and physical movement. This moment represented everything the Neural Interface project was meant to achieve. Not market dominance or corporate valuation, but tangible improvement in a patient's quality of life. That's the first time I've really walked, controlling the movement myself in 3 years, Michael said, emotion evident in his voice. Your father started this technology, didn't he? He envisioned it, I confirmed. But it's taken many dedicated researchers and brave participants like you to make it reality. After the therapy session concluded, Dr. Patel walked me through the data collected during Michael's breakthrough. The refined system shows none of the signal degradation problems we saw in earlier versions, she explained, and the safety protocols are responding exactly as designed. Lauren's team has transformed this technology. When do you think we might be ready for expanded trials? I asked. Based on these results, I'd recommend moving to the next phase within 3 months, she replied. We have 15 pre-qualified candidates eager to participate, and the FDA has expressed support for our methodology. This timeline represented meaningful progress while maintaining appropriate caution, exactly the balanced approach I had emphasized since restructuring the program. Not rushed to meet arbitrary market deadlines, but advancing steadily with patient safety as the paramount concern. As I prepared to leave Clearwater, I received a call from Eleanor Winters. The settlement with Daniel's attorneys has been finalized, she informed me without preamble. Full admission of corporate espionage activities, cooperation with prosecutors regarding Vertex executive involvement in exchange for sentencing considerations. This development represented another step toward resolution, accountability, without the additional trauma of a protracted public trial. While Daniel would still face significant consequences for his actions, the negotiated plea would spare both Horizon and the patients involved in unauthorized testing from the scrutiny and potential privacy violations of court proceedings. That's good news, I acknowledged, for the company and everyone involved. There's one more thing, Eleanor added. Daniel has agreed to relinquish all claims to the neural interface patents as part of the settlement. Full ownership reverts to Horizon, with appropriate credit to the research team members who contributed legitimately to its development. This final element of the settlement addressed a potential complication that had concerned our legal team, the possibility that Daniel might attempt to claim personal ownership of key technological innovations, potentially complicating Horizon's ability to continue development or eventual commercialization. That provides much-needed clarity moving forward, I noted. The research team will be relieved. By the time I returned to Horizon headquarters, the afternoon sun was casting long shadows across the lobby atrium where my journey as CEO had begun 3 months earlier. So much had changed since that first day. The company's structure, its governance approach, its research methodologies, and perhaps most significantly, its cultural commitment to balancing innovation with integrity. Lauren was waiting in my office, her expression reflecting the excitement I'd witnessed at Clearwater. Michael took steps, she said simply. Real, neurally controlled movement. I was there, I confirmed, unable to suppress a smile at her enthusiasm. It was remarkable. This validates everything we've rebuilt, she continued. Not just the technology, but the approach, methodical development, proper safety protocols, transparent reporting of both successes and setbacks. We're making progress precisely because we're doing it right. Her observation crystallized what had been emerging as Horizon's new organizational philosophy. The recognition that ethical processes actually accelerated meaningful innovation rather than impeding it. By eliminating the distortions of manipulated data and unrealistic timelines, the research team had achieved breakthroughs that might have been missed in Daniel's rush to market dominance. Later that evening, I found myself on the rooftop garden. That had been my father's favorite retreat within Horizon's headquarters. The space had been neglected during the turmoil of recent months, but I had recently commissioned its restoration, another small way of honoring his legacy while making the company genuinely my own. Howard joined me there, carrying 2 cups of coffee. "Impressive results today," he observed, handing me one of the cups. The board meeting, Michael's breakthrough, the settlement, all significant milestones. It feels like we're finally moving forward rather than just repairing damage, I agreed, looking out over the Boston skyline as lights began to illuminate the gathering dusk. "That's leadership," he noted. "Not just crisis management, but vision implementation. You've transformed Horizon more fundamentally than simply restoring what existed before." His observation resonated with my own reflections. While the initial challenges had focused on addressing Daniel's misconduct and securing compromised intellectual property, the more meaningful work had been reimagining what Horizon could become, a model for responsible innovation in medical technology that other companies might eventually emulate. My father believed that integrity wasn't just a corporate value, but a competitive advantage, I said after a moment. That patients, providers, and regulators would ultimately recognize and reward companies that prioritized safety and transparency alongside innovation. He was right, Howard affirmed, and recent events have proven it conclusively. Our stock recovery is outpacing industry averages precisely because we've demonstrated commitment to those principles under difficult circumstances. As twilight deepened into evening, I reflected on the journey that had brought me to this moment. What had begun with the shock and pain of seeing Daniel with Vanessa at my father's funeral had evolved into something I could never have anticipated. Not just personal resilience, but the opportunity to reshape a company in ways that honored my father's deepest values while establishing my own leadership vision. Daniel had brought his mistress to my father's funeral, never imagining that my father had left me his company, a company I had now protected and transformed despite Daniel's attempts to exploit it for personal gain. The painful ending he had orchestrated had inadvertently led to this new beginning, one where both Horizon and I were emerging stronger, more purposeful, and more authentic than before. Tomorrow would bring new challenges, expanding the neural interface trials, launching additional research initiatives, continuing to rebuild investor confidence. But tonight, in this peaceful moment overlooking the city my father had loved, I allowed myself to acknowledge how far we had come and the promising path that lay ahead. Not just for Horizon, but for the patients whose lives would be transformed by technologies developed with equal commitment to innovation and integrity. The betrayal that had once defined my relationship with Daniel had been transformed into something far more meaningful than mere personal vindication. It had become the catalyst for rebuilding not just a company, but a vision of how medical technology could advance, guided by principles that prioritized human well-being over market positioning, substantive progress over artificial timelines, and genuine innovation over corner-cutting expediency. As stars became visible in the darkening sky above Boston, I silently thanked my father for his final gift, not just ownership of Horizon, but the opportunity to discover strengths within myself I might never have recognized otherwise. The company under my leadership would be different from what it had been under his, adapted to new challenges and opportunities, but the fundamental values would remain unchanged, a legacy honored not through preservation of the past, but through evolution toward a future he would have embraced. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.